afternoon, everyone, on this wonderful snowy afternoon here. Maybe we can lighten your day a little bit to learn about some chiropractic and pregnancy. You know, my story, I had all three of my children at home, and chiropractic was a vital part of that to make sure that my body was completely ready and able to do what it's meant to do, is to deliver babies. So, you know, I utilized chiropractic care during my pregnancies, not only because I had some back pain, but also because I know that there's a lot of other benefits that are helpful for pregnancies. You know, one of the biggest things is pregnancy and chiropractic helps with is pelvic alignment. You have to make sure baby fits appropriate through the birth canal, and chiropractic can help with that. And so that's why you don't necessarily need to be in pain to get some benefits from the adjustments. You know, one of the things that happens through pregnancy is as that uterus gets bigger and bigger, we're kind of our center of gravity changes, right? And so what happens is we start to lean back because we have a belly out here, and we just kind of lay back on what's called the facet joints. And the facet joints are kind of those puzzle pieces in the back here. And so when that happens, it puts a lot of stress on there. The other thing that happens is you release the relaxin hormone, and relaxin hormone is what's made to help your big sacroiliac joints expand so baby can fit out, and there's other joints and ligaments as well that relax in order to allow the baby to fit through the birth canal. But when that happens, you're loading the facet joints, those SI joints back here start to open up a little bit, and that can be really uncomfortable. The other thing that happens is when we do this, you know, we don't walk around with our head, we start to push our head forward. So we carry our head forward, we load our back, and while our bodies are designed to take on this load and this pressure, they're not always designed to do it while you continue to maybe be a chiropractor where you're physically working all day, or maybe you're working in a facility where you do something repetitious, or maybe you have to sit all day. And when you're not able to get up, or you're not able to change positions, or you're overly stressed and physically stressing your body during this, your body can't adapt well enough to these changes. And that's where chiropractic can come in and be really helpful. Helping them adapt those and load the joints properly during pregnancy. So one thing I want to show you, and what I tell a lot of my patients, is how we can help with the pelvic alignment. We don't do any obstetric care, we don't work with the baby, we don't touch the baby, we just work on mom's pelvis. And we work on some of the ligaments in there. And so I did made you guys a little diagram here. And so, not a diagram, we got a live person here. And what I used to call this, I forget what I used to call them. Well, it's a female now. So. And so here's a model of the spine. We've got nice curves in through here, and this balloon represents uterus, right? And what I tell my patients is there's kind of a relationship between the back of your pelvis, which is called your sacrum, and the uterus. And we kind of have to think about it like a hot air balloon. Okay, so if you picture a hot air balloon, there's the balloon, the big part, and then you've got 4 strings, or potentially more, but in this case 4 strings holding onto the basket. Okay, so what would happen if you twisted the basket? What would happen to those strings? They'd start pulling on the uterus and things like that. So, you know, as these SI joints start to expand and relax during pregnancy, and that can move around, it's going to pull on these ligaments. And I kind of taped them on there so you can kind of see. These are the round ligaments in the front, and they attach from the front of the uterus down to the anterior part of the pelvis. And then we've got some in the back. Okay, no judging, no judging my ligaments, but the uterosacral ligaments as well. And so, you know, if like I said, if something moves in through here, it's going to pull. Like, well, try not to pop the balloon. It's going to kind of pull and yank and change the shape of the uterus. So maybe, for example, a baby has a hard time going head down because there's some torque and there's some stress on the uterus. So maybe we come in and we check some of these ligaments, and if we adjust appropriately, then that relaxes these ligaments. The uterus can go back to how it's supposed to be, and the baby will shift to head down like it's naturally trying to do without the restriction in the way. One of the techniques we use in here is called the Webster technique. And what that does is it's a way of analyzing how the pelvis is sitting. And it's a really useful tool to make sure the pelvis aligns. And a lot of times the result is that the baby's head will then go down once we have that stress taken off the uterus and the ligaments in through there. So again, round ligaments up through here. If you ever get tenderness on the front side, especially if you're like twisting and it pulls really hard, we can also do work on the ligaments too. So we don't have to just adjust back here. We can do some soft tissue work to the front as well. Some women get some soreness down in through here in the pubic bone, and that's because that relaxin hormone again is letting everything spread out, and it can be really painful. So there's some techniques that we do down here that would be very helpful to ease the pain too. We do some kinesiotaping, we can do some light adjusting, and some soft tissue work. Kinesiotape is awesome. We just basically put some tape on in through here, which helps support the belly, and that takes some strain off that pubic bone in through here. And again, coupled with some light adjustments, we usually see some really great results with that. So that's with chiropractic adjustments there. What I would like to do now is, anyone have questions, Nikki?
No, so far no, but
okay.
There are a couple people watching, so if they pop up, we can.
What I would like to do is, I said we're going to do a live demonstration. Because of the snow, we don't have a pregnant mom in here today. So we're going to demonstrate on Nikki. So she's not pregnant.
Not pregnant.
Not pregnant, but we're just going to make believe. Now I'm just kind of show you the gentle technique that we go through in the office and how we can accommodate for the belly. Moms find it's really comfortable to come because they can actually lay on their stomach, something they don't get to do very often. So come on up here. Let's go in that adjusting room up here.
Switch
it up. You can come with me. Come over here, because that way, so this is one of the tables that we use in here, and how it accommodates for mom's belly is this actually pops open, and we can lower the pressure. Look at that. And then we always use a pillow to support. And this one actually has a cutout in the middle, and so belly can sit right in through here, and most people are very comfortable. If we get up towards the end of the pregnancy, we have a bolster that we put underneath, which even give more room for the baby. So again, no stress on the baby, very comfortable. So we'll have fake pregnant mom lay down in here. Yeah, very good. And so with that Webster technique, one of the things that we do is we check those ligaments that I showed you on the spine. The sacrotuberous ligament is one of the real important ones in this equation. And that, we always say it's like the steering wheel to the pelvis. So if it's really tight, it's going to pull the pelvis and the sacrum one way or pull it the other way. And again, just picture that balloon in that basket and twisting those ligaments. So it's just a way of unwinding the pelvis so everything can be completely relaxed. So, I do some leg checks and I just check the tension and everything in through there. And then we check that Webster technique. We check it right on that sacrotuberous ligament and just kind of do some nice soft holds on there. Nikki, does this hurt?
No.
No, it's very gentle. Yes, very gentle. So we just do some soft holds on here. I do some drop adjustments on through here. So like this side of her pelvis is twisted back a whole bunch. And so what we would do with the pregnant mom is we would only use the pelvic drop piece. Is that touching your belly at all or no? Uncomfortable in any way? No.
Nope. So far.
And so we just kind of get on the pelvis, do a nice light push, and it falls down. And that way the pelvis twisted back, and we have some more relaxation, and that sets in. If you saw my first webinar, that's where that parasympathetic tone comes in and relaxes everything and gets the neurology calmed down and healing in that location. So we can work all the way up and through the spine and through here. And then I'm just going to actually have you turn over, and we'll show you kind of where we would work on those ligaments on the front side. Whoop, that's good. And so those round ligaments are right in through here. And on Nikki, I can just kind of go in and feel like, oh, look, baby in there. And sometimes it kicks me. It's cute. but there's not.
No babies.
No.
So we just pretend like we found, just a light, a tight ligament in through here. That a lot of times that's part of that Webster technique that we look at. The pelvis rotates one way, the ligament's tight on the other side. And so we just do some soft, gentle holds. Maybe we'll have her drop her leg off, which will stretch that out a little bit. Again, is there any pain?
No.
No, I'm just getting kicked by the baby, that's all. super gentle techniques, especially when we're pregnant. Good. And so we can also do some neck adjustments too if need be. And that's kind of the gist of what we do with that Webster technique. And so you can go ahead and come on up. Thank you, Nick.
Yeah, you're welcome.
And then even under the best circumstances, and like I said, I had 3 home births, and I had chiropractic care doing all of them. I ate healthy, did all that. Pregnancy can still be stressful on babies, so we always highly encourage moms to bring babies in afterwards and make sure that everything went well. It can be like with my Beckham, and he was kind of in there a little bit crooked despite all the things that we did in the chiropractic care. And so right afterwards we had to do a lot of work, and we still do work to this day, adjusting him and making sure that he develops properly and healthy that way. So highly encouraged, like I said, even under the best circumstances, pregnancy, even in natural states, it can be really stressful. So that's where we see babies and things in here too, to try to prevent further issues. And we do really well with colic and some digestive things. And we have a lot of just resources here. So if you're looking for natural alternatives or just ideas, feel free to reach out and ask us questions about any of that too. Okay? If no one has any questions, Julie, anything pop up?
No questions.
Okay, awesome. Well, thank you, everybody. Have a wonderful afternoon.